and getting fresh air by going on walks.
Farm workers are considered some of the group's most vulnerable, especially in this new surge of COVID-19. But they might not be taking advantage of programs that are meant to help them or even know that they exist. Fox 40's Lonnie Wong explains how organizations are spreading the word that assistance is out there.
Agricultural workers are essential for providing food for the population. But because they work closely with others in the fields and in processing plants, it has shown high infection rates and outbreaks of the virus among farm workers.
You can't telecommute the harvest. You have to be there picking the harvest.
Work continues for ag workers even after the harvest and into the winter. Seasonal workers often travel to where the work is, and the shortage of housing often means crowded living conditions for workers and families.
Not having a space and having people living there from 6 to 10 members.
That means self-isolation or quarantining is hard. That's why state legislation along with federal funds are being used for the Healthy Harvest program. It helps infected ag workers with services like special quarantine housing, food, and other support services, like $1,000 a week in wage support for those who choose to work when they shouldn't because they can't go without a paycheck. A key component is medical support, no matter where their seasonal work takes them.
So being able to connect with a health clinic that will be able to do telehealth, make sure that they are monitoring their symptoms and that they're staying healthy during their quarantine.
The services are there, but the fear is that ag workers, especially in the Latinx community, don't know about them or are hesitant to sign up. The La Familia Counseling Center is trying to get the word out that help is available. Sacramento City Council member Eric Guerra worked the fields when he was young and says those workers concerned about privacy have nothing to fear.
We don't ask for any background information about their immigration status. We just want people to be healthy and be able to protect their families.
And by extension, everyone else.
Because if they're safe, then we'll be safe as well.
There is some urgency because there is a time limit on the expenditure of federal funds for the program. It ends at the end of the year. Although because the need is so great, there is talk of an extension. In Sacramento, Lonnie Wong, Fox 40 News.
That center says that if you know anyone who might be eligible for that help, to contact them. They've also set up a hotline making it easy